Good evening, Central Indiana, and welcome to a special Wednesday edition of Porch Time with your host, Kevin Coriel, live from JTH Construction Studio. Real quick before we get into it, as you can see, Doc's in here with me tonight. How you doing, PJ? I'd like to thank our sponsors, JTH Construction. Joe, thank you so much. American Basement Solutions. As much as it's rained today, you might need to get a hold of Larry Ralph Sr. Look at your foundation. Well Springs with Mr. Bob Goodrum. I'm happy to have them on board. Blandon Boys Lawn Care. You might need him to shovel snow before this is over with. Just Winging It. Reps Fitness. FindHelp.org. And I'm missing one here. And I just saw, oh, of course, Stids Comfort Systems. Keeps us cold in the summer. It's going to keep us warm this winter in here. I think that's about it. If you'd like to be a sponsor show, get a hold of myself or Bethany Latham, and we will see what we can do on that. First day of fall. It didn't play around with us today, did it, Doc?
It didn't stop raining at all
No.
today.
It was 54 on my drive home, and I was like, I like the cooler weather, but I was hoping for some nice weather with the cool weather. So
it was like every time I looked outside the clinic today, it was just downpour.
Rain. Well, you're in here because you have some big news. You've been over at Terre Haute for so long, but now you got some news for the local folk here.
Yeah, so today was my last day of work at the clinic in Terre Haute, and I'm going to start accepting patients here in the beginning of October.
Good deal.
So a lot of what I do, I'm a physical therapist. I have my own company, home business. It's Performance Physical Therapy, which you can give those pages a look on Instagram and Facebook. But right now, I'm going to be based out of a gym here in town called PRT Gym. It's there on Morgan Street across from the Family Dollar. But a lot of what I do is gym-based physical therapy. So, it's not going to be like your traditional outpatient setting, things that you're used to. It's a different take on physical therapy, and I've had a lot of success with it. So looking forward to bringing that to the area for sure. So
let's do a little history here. Your family's from here.
Yeah.
Your mom and dad.
Yeah, my mom's Kim Applegate and my dad's Mark Applegate.
I know them both well, good folks. And you've been doing this for how long?
Just over 2 years.
And went to school for it, and you've got tons of credentials to follow you.
I'm going to need a stamp at some point. But.
When I started typing the shot, he goes, "You don't have to put all my stuff tonight." I was like, dude, it's like a book. Well, it's a lot. It's it's your hard work that the reason why you have those letters by your name, and that's pretty cool. So you're coming back home and gonna open it up here.
Yep. So I'm kind of like half and half right now. I do have a different job in Brazil for a little bit, but I will have more time to do stuff here in town, and it's kind of like bridging the gap. So as I get more patients here, I'm going to be transitioning to where I'm doing this full time in town.
And what kind of therapy are you talking? Let's say, I'll just throw a scenario. I'm a 54-year-old man. I decide that I can play softball still, and I go out and I blow my knee out.
It's funny because I'm on a softball team right now. And
this was not set up, folks.
And I was talking to my dad about this before on my drive over here. But we had a game on Monday night. One of the guys on the team is 52. He was our catcher, and there was a play at the plate, and the ball was like a bad throw to the catcher, and he had to take off running to tag the guy coming from third, and he pulled his groin when he was doing that. And I talked to him after the game, and saw him the next day. We did some dry needling, some manual therapy. That's what I do a lot of like hands-on stuff.
He tortures me with the dry needling thing.
I probably do it at least,
hey Tony,
like 3 or 4 times a day on my patients.
Really?
Yeah. So
that must be successful then.
Yeah.
Crystal, I think she normally jumps on here.
Yeah.
She swears by it from you.
Yeah, she's doing pretty well now. She's gonna come in for like a little checkup visit whenever I start seeing people over here in the gym. So, but yeah, she's.
So you're treating the gentleman that got hurt in the softball game.
Yeah. Yep. He pulled his groin, having a lot of trouble even just like sitting and getting up, walking around. Did some dry needling, which that usually takes like 20 to 30 minutes to do, and then gave him some general movements, some like isometric work, which is just like, think about if you like flexed a muscle but you didn't really move like the limb a ton. But those are good for like pain relief and kind of these like early on like goals for getting somebody moving again.
Right.
But by the end of the hour, he was, walking around more comfortably. Definitely not going to be playing softball anytime soon, just because of
that's probably best. The
nature of the strain. He'd be, at a good risk of restraining that muscle. But yeah, he seemed pretty happy with how it felt afterwards. So
yeah, you age groups wise, you take.
So I will treat pretty much anybody. I primarily work on people who are suffering from like orthopedic conditions. So if you have any type of like joint ache, muscle pain, low back strain, whether it's acute or chronic, you can come see me. So even if it's like headaches are something that I like to treat a lot. They respond really well to some dry needling and manipulation.
You're going to have to explain that. Where do you put dry needles at for a headache?
So it kind of depends on the headaches. There are like multiple different types of headaches.
I get sinus headaches is what I call them because I have bad sinuses.
Are they like through the front of the face?
Yeah.
So they might be more of like tension type headaches. But if you have more of the headaches that are like through the eyebrows and like the forehead, have you ever like heard when you have a headache to like push in right here?
No.
Okay. Well,
is that one thing to do?
That's one thing that some people do, or it's along the lines of like the pressure points stuff. But that's actually one of the areas that I dry needle. There's a muscle, like when we say craniofacial, that's referring to like the musculature, the soft tissues, tendons, ligaments, all that stuff of the face. There's not many ligaments in the face, but all those tissues, when you get a lot of tension, whether that's from stress or other factors, those muscles can kind of tighten up, and that can create what we call tension type headaches, which are usually just kind of like diffuse throughout the face or diffuse throughout the scalp. If you feel like you carry a lot of tension in your shoulders, that kind of stuff, and you get headaches frequently, dry needling would work pretty well for that. So
it's just like pressure release.
So there are a lot of like ways that dry needling works, without like going into the like physiology of it, which if anybody ever wants me to, I can talk about that.
He knows his stuff. There's no doubt about that.
Basically, it kind of like stimulates production of these certain neurotransmitters that are responsible for pain relief. So headaches are actually a pain stimulus. So your brain is perceiving that as pain, and we just call them headaches. But that's why dry needling works to reduce those headaches. So like the tension type, or if you feel like you've got one of those headaches that kind of starts at the base of the skull and wraps up and over. Sometimes it feels like it goes behind your eye.
Yeah.
They're like one-sided a lot. Those are cervicogenic headaches. That just means that it's stemming from some of these upper cervical joints in your neck. But those respond really well to dry needling as well. I also crack people's necks a lot for headaches. So, but that's just one of those things where it's like, if it's a cervicogenic headache, popping necks and dry needling like knocks them out.
If I get Billy in here, can you crack his neck for me?
So Indiana has some really dumb laws. So I can't crack a neck unless the patient has a script from a physician, or a chiropractor. But like my patients that I see, I'm usually calling their family doctor beforehand and like, hey, this patient's scheduled. They're coming in for physical therapy. We're going to need a script anyways. Do you mind sending one?
Sure. And
at that point, they're good to go.
So can doctors refer patients to you?
Yeah. So like they don't need to that's the thing. Like if you look at the states around us, each state has their own like Physical Therapy Practice Act. So Kentucky, Ohio, Illinois, Michigan, all those states, PTs can manipulate freely. So they can pop necks and backs, no problems.
But we can't.
We can't. That's kind of like a quarrel between the chiropractic profession and the PT profession. That's the only reason that's there. But it's still part of the physical therapy scope. If you like look across the country, there are multiple states where PTs are popping joints. So like if I want to pop an ankle or a knee, I can do that without a script. It's just
not the neck,
not the spine,
right?
Because that's kind of like where chiropractors like to say that's their
domain.
Yeah, but it's also the physical therapy domain.
Have you ever been down to the adult daycare center here in town? She runs it, and I'm long day at work, and I'm trying to figure her name out, and it's Susan Lowe. She runs an adult services daycare down there where elderly come in and they do games, and I'm like, I bet you every one of them would want to see you for something.
Yeah, especially with and these are just like trends that I've seen with like the pandemic, particularly with older adults. Everybody got confined to their houses and that kind of stuff. And for a lot of older adults, that was, caused a lot of like changes to their health, both physically and mentally. Like they're not up moving around as much.
Right.
So, muscle strength, balance, that kind of stuff, we lose really, really quickly. You'll hear if like you don't use it, you lose it type of phrase.
That's a fact, isn't it?
Yeah. So because I got furloughed for a little bit when I was working for that clinic in Terre Haute, and when I came back, a lot of my caseload was like older adults who were coming in for just like generalized weakness and balance problems. So that's another thing that like PT does, is we do a lot of like fall prevention, because most older adults who like fall are at risk for sustaining like a fracture, just because they have poor bone health compared to younger people. And then when they have a fracture, they get put in the hospital. When they get put in the hospital, now they're exposed to all these other illnesses, that kind of stuff. And sometimes they don't make it out just because they fell and, had a fracture. Right. So we want to prevent that as much as we can. So we do a lot of stuff to prevent that.
Does you work mostly with the elderly, or do you?
So out of my experience that I have, so in the traditional outpatient clinic that I worked in, I did see a lot of older adults, where like performance is centered around, it's more centered around active adults, or just active populations. But with that being said, I work with everybody. So I try to appeal more to the people who are more active. Right. But if somebody is less active and they've been dealing with this pain forever, I want to help them out too.
Send it to you.
Yeah. So I treat everybody that has an orthopedic condition. Like I don't do stroke rehab or spinal cord injury rehab or anything like that. That's you. I'm the last person that you would want doing that. Right. There are different PTs for that. But
I'm being nosy. How many patients do you currently have?
Well, I've been phasing out of Terre Haute. So far in Terre Haute, I think over the last year, I've had about 40 patients or so. Just doing my stuff in the gym. In the outpatient clinic, I would say in the last 2 years, I've seen, close to 1,000 patients probably. Really? Yeah. So there's a lot of people that come through the door for PT. So
that's good stuff. But we got to get you out here and advertise, because especially with winter coming, that's the season to blow knees out, lifting snow and falling and everything else.
Yeah, Indiana has direct access. So, if you develop some kind of pain from like lifting something too heavy, or if you've been dealing with the pain for a long time, you don't need to go to your physician first. You can, your family physician. Yeah, you can just go straight to PT. And if you don't want to work with me, you can go to a PT clinic anywhere. Right. Like you can go to an outpatient clinic. It's completely up to you. But a lot of people just don't know that they have that access to care. And a lot of times they end up getting, going to their family physician. Family physicians are not, musculoskeletal experts like PTs are. Right. So you're going to end up getting a lot of imaging that you don't need. Like,
you're going to get charged for them to look at it and then eventually send you to PT.
Like who wants to get like a $2,000 MRI that is going to pretty much tell us nothing?
Right.
You know, if you're a person who's been dealing with a pain for, months, imaging is not even warranted. Now, if you fell down or something and, there's some kind of trauma associated with it, like you got in a car accident, yes, let's do some imaging. Like they're going to start with an X-ray, rule out any fractures, that kind of stuff.
Sure.
Which that's, a good procedure to do. But when people who've been dealing with back pain forever go into their family doctor and they get, X-rays and MRIs scheduled, that's a disservice to the patient. There's tons of literature out there that shows that getting an MRI early on in the management of like spine related pain conditions significantly increases the time it takes for patients to get better.
Right.
It also leads to them spending a lot more money. And, if they went to therapy first, they typically spend less money and get better faster. So,
will he look at me for all the fouls I took from Brian's talking about me in basketball growing up?
Absolutely.
And carrying me. Just curious, will insurance cover?
So I don't take insurance directly, but that doesn't mean that you can't use your insurance. So basically I am no longer the middleman, because that's how like traditional therapy services go. So like you go to an outpatient clinic, they'll verify your benefits, and then insurance will say, okay, we pay this much. So the clinic might charge, end up around $150 a visit, and then insurance will go, okay, we'll give you 70.
Okay.
And you'll take it.
Okay.
So that's kind of, I don't want to deal with that. So I have my like set rate, and then I basically give you a bill. And then you can submit that to your insurance and get your reimbursement that way. So I'm considered an out-of-network provider. So for people who have like an HSA or an FSA plan, they can use those plans.
Discounts, right?
Yeah, you can use your HSA or FSA to pay me directly. If you have like a high deductible plan, you're going to be paying out of pocket anyways,
right,
until you meet that deductible. So you might as well pay for, service where you're going to get one-on-one treatment with the same person for an hour at each visit, and you're only going to see me once a week.
Right.
So like think about, would you rather go once a week or 2 to 3 times a week to, get better?
Right.
So that's kind of the caveat to my services. You're going to pay a little bit more.
And you're right here in town now and going to be local.
Yeah. So
good question, Dan. And Brian, I think you should come in here and let him do some dry needling on you. I know you got some stiff joints and all from me pounding on you when we were younger, and then about carrying me. I don't remember that part, but he's a good man.
Yeah. For anybody that's interested in working with me, I do monthly workshops at some of the gyms here in town. So this October 9th, it's a Saturday, at 10:30 a.m. we will be holding a shoulder workshop. So if you're having any type of shoulder pain, this would be one that you would want to attend. It's only $10. It'll be for about an hour and a half at most. I stick around and talk to everybody. So if you have a question, I won't leave until, I've answered your questions.
Sure.
So
now where's it at?
It's at Bars on Fire CrossFit.
Okay.
It's like right there across from where the Bigfoot used to be.
Right there on Main Street.
The old Goodyear building. Yeah.
Yeah, they have a big crowd of people in there normally, it looks like. It's a pretty good deal going there.
Yeah, I had a workshop last month. It was a ankle mobility workshop. Because who knew your ankles could cause shoulder pain?
Really?
Right? Yep.
October 9th, correct?
Yep.
Yeah, October 9th. Yeah.
October 9th at, Jessica.
There's Jessica. We look forward to having you on Bars on Foot. Yep.
Yeah, we did our ankle mobility workshop back in, it was last month. I have had a wedding every weekend this month that I had to go to, so I couldn't do one.
Not your
month.
own though, right?
No, not my own.
Say you
not
set
yet.
some sort of record.
Not yet. Yeah, but we had I think there's about 14 people there. It was a really good turnout. So,
well, good.
But a lot of people seeing some of those like immediate changes from some of the stuff that we were doing in there. So, I pretty much teach you how to take care of your shoulder on your own. Kind kind of teach you how to evaluate your own shoulder so that, you can learn how to take care of yourself. That's my main goal. I don't want you to have to come back to me. But if something does flare up and, maybe something new happens, like you're playing a pickup game and you tweaked a knee or something like that, you can come back to me. We'll get it taken care of quick. And then I show you what to do to kind of maintain your new health. That way you don't have to come back. That's my plan. So
you said this earlier about COVID with a lot of people quarantined at home. Have you noticed, like you said, a lot of people, elderly people from sitting? I assume you're getting, like you said, a lot of those folks in because of that. And is that something, as we keep going through this, I'm sure there's people out there with older relatives, grandparents, parents, that they can look at right now and say, hey, Pops, is your knee hurting you or something?
Yeah.
Send them to you, let them at least get a look at it and let you put something in their ear to say, got to keep moving.
I do free phone screens. So any person that I go to work with, I typically do like a 15-20 minute phone call with them before they even come into the clinic, so that I can kind of like triage and see, like, is this something that, I'm going to be able to help you with, or do you need to go see, another provider based off of some of the symptoms that you're telling me? That's kind of some of the reason that PT is a doctorate now. Like we, have this ability to look for some of these like red flag items. Like, is this some other like medical condition that needs addressed?
Sure.
Yeah. Cause like, think about like heart attacks, people having the pain down the left arm. Somebody might come into a clinic saying, yeah, my left shoulder's just been hurting. I need to be able to, tease out, well, is this coming from like a cardiovascular component? Is he having referred pain this way? Or is this a true like musculoskeletal condition that I can treat? And in order for us to be able to take these patients through direct access, we need to know how to do that. And PTs do a really good job of that. So
you went to school for a lot of stuff, didn't you?
Yeah. And like, I'm not only advocating for like me as a physical therapist, but like any physical therapist. So like, if you don't live in town and you live far away, like you can go see a PT anywhere.
Right.
Yeah. You don't need to have that physician script. Eventually you'll have to get one, but usually you don't have to do anything to take care of that unless your physician just refuses to write a script and wants you to have to come in for that office visit.
I mean, I can sit here and think of about 10 people in the last 6 months that have told me, oh, my ankle hurts or my knee gets swollen or it's something. They need to come see you.
Yeah.
Come see you and get it figured out, the causes, and get it corrected.
Yeah. Yeah. And like one of my big things is like health promotion, kind of like the wellness and maintenance side of things. So like if you are currently in a condition where you feel like you can't exercise, everybody can exercise to some degree. We just have to tailor it to your current fitness level. Like if you're having some kind of pain or injury, let me help you get through that so that we can get you into moving more often, because movement is medicine. So you'll hear me say that a lot. There are a lot of, conditions like obesity, diabetes, congestive heart failure, hypertension. All these things are preventable for the most part if you can modify your lifestyle factors, and that's something that I want to be able to help people with.
No, I have not gone in to be assessed. Thank you. She's in New Zealand, by the way.
Gotcha.
She's gonna give me guff, so that's part of it.
Yeah. But so like with me partnering with gyms, it makes it very easy for me to streamline your care. So like if you wanted to come in to have me work on you or something, let's say you were having hip pain, now I got your hip better. Now I've got all of these like strength and conditioning coaches or strength and conditioning professionals that, can help you progress through your exercise routine and get you more active. Like there's good communication, or there's going to be better communication between us as I start working here more, and referring patients to these gyms and stuff. But that's kind of like my approach to getting people out of pain and getting them healthier overall.
No more pain. We need to make shirts that say that. No more pain for you.
Yeah.
You probably have some. So are you tied to every gym here in town now, or?
Not yet. So right now, just paired up with Bars on Fire CrossFit and PRT Gym. So PRT Gym will be where I do all of my treatments and stuff. But so far, I'm just doing workshops at Bars on Fire, and then we will be doing more workshops at PRT as well. I think they're trying to expand their space a little bit. So if that happens, then there'll be more room and we can have a workshop there. So
Sure.
But yeah, as of right now, my workshops are at Bars on Fire, but I'm open to other locations as well. So,
and you have website or Facebook page and everything that if they want to get a hold of you.
Yeah. So if you just search me on Facebook for at Performance PT Indiana, it's the same on Facebook and Instagram. So,
and I have seen that page. October 9th is your
that'll be the shoulder pain workshop at Bars on Fire. So it starts at 10:30. It's $10. And there will be a waiver that you have to sign at the door before we get started. So,
heard that Planet Fitness is coming to town.
Huh.
I have not heard that.
I don't traditionally like Planet Fitness. That's my. I mean, I would do workshops there if they wanted me to, but
right.
From my opinion is that based off of their business model, doesn't really seem like it's oriented around your health.
I think we have 4 here in town right now.
Yeah, I know there's an Anytime.
Reps Anytime. Your place.
PRT.
And then Bars on Fire.
Yeah. And then there's also Strength School.
Yeah, which is out of
Reps. Okay.
Yeah, out of Reps. Yeah.
Gotcha. I didn't know if they were there.
I don't know if there's another one south of town. I was thinking there was maybe another one south of town, but 4 in a community our size that's pretty good coverage.
Pretty good. Yep.
Yeah, that's why I was kind of shocked.
Even the YMCA, you could count that as a gym too.
Sure.
And that would be, I think, for patients who are elderly and have balance issues, that kind of stuff. I think that'd be a good area for me to set up and do some fall assessment and balance screens. The only downside is that there's only one of me. So it would take a considerable amount of time. Right. It might be a multi-day
Well, that's why
thing.
I suggested you go down here and talk to Susan, or even at the Waters or somewhere where they're dealing with the elderly quite a bit. Getting your name out there is not going to be hard. You're from here.
Yeah.
You know quite a few people, and I'm glad you've made the trek back home because I think you're going to do well here.
One of the things that I want to get started, there are these walk with the doc programs, but I'm going to rephrase it and called a performance wellness walk.
It's got to rhyme though.
Wellness walk. That's
if I hear walk, we're cooking Chinese food is what I'm thinking.
Maybe I'll have a stand set up. It'll
there you go.
Be counterproductive though. But cardiovascular health is something that is you'll hear hypertension is the silent killer. A lot of people don't get their blood pressure taken regularly, but you could just be safe and assume that you have high blood pressure if you haven't had your blood pressure taken. But regular cardiovascular activity, the minimum effective dose to make a positive change to your blood pressure is 30 minutes of brisk walking 3 times a week.
The minimum effective dose to change your blood pressure.
The least amount of exercise that you have to do to make a positive
30 minutes
outcome or make a positive change to your blood pressure, or cardiovascular health overall, if you want to think of it that way, is doing 30 minutes a day or 30 minutes of brisk walking, which is about 3 miles an hour, for 3 days a week.
Really?
Yeah. So doing these performance wellness walks, it would be something where, one night out of the week, I would like to meet at a location here in town and just,
they've got a nice walk path up at the park now.
Yeah. I was thinking about what about in the wintertime though? That'd be terrible. Some kid come.
You can always go to the fairgrounds and walk through the barns. You just have to map it out distance-wise.
Yeah. And that's the other thing is it's not distance-based. It's just time spent exercising.
There you go.
So you just need to walk for about 30 minutes at 3 miles an hour, which is just a brisk walk for the most part. And doing that 3 times a week. And that'll go a long way for your health too. So, But this is kind of where we come into. People are like, "Oh, I can't walk that long because my knee hurts."
My knee hurts.
So that's where your physical therapy comes in. So get your knee taken care of so that now you can do these other things that are going to make even more positive influences to your health overall. So
good deal. Any questions, comments, concerns, jokes? Everyone should be in shape in town.
That would be great.
You would think that, but then you'd have to move to a different town.
If I didn't have patients coming through the door, I did my job. Like that would be the best thing ever. Because
I think you're always going to have patients.
Yeah, because there's always going to be people that are hurting or something like that.
All right, but I'm going to ask you this because I've heard a lot lately, both sides, and I did this. We've all done this playing basketball at some point in time.
Mm-hmm.
I roll my ankle. It hurts. Well, I'm going to take it step by step. First thing, some people tighten your shoe up.
Mm-hmm.
Is that a go or no go?
If you're going to keep playing.
So you're not against...
like tightening your shoe up?
You're not against that?
Yeah, if you just tweak your ankle or something like that, and, it's not a terrible pain.
Right.
And you just lace up and keep playing, it's not going to be... Okay. Now, if you lace up tighter and you're, like, still hobbling around...
Forget it.
Probably not doing much good for you,
So let's say I hobble around, I decide I'm done. I go home, and the first thing someone tells you to do is elevate it and put ice on it.
Yeah, so that's kind of like an older like thought process.
Right.
The guy that came out with like rest ice compression elevation has like come out and said, maybe not the best thing for tissue healing. So like inflammation is like the first stage of tissue healing. So it's not a bad thing to have inflammation. It's bad when, you have so much inflammation that now you've got a ton of swelling in your joint, can't move freely. Where like physical therapy comes in is we want to get that thing moving as soon as possible, because a lot of like movement is also helpful at reducing swelling and inflammation, as long as you're moving in a way that's not like painful. It's not making your symptoms worse.
Okay.
So like if you twist your ankle and you go to your family physician, you're going to get put in a boot, and then you're going to get sent to physical therapy, and they're going to say you need to wear this boot for 6 weeks. Worst thing for you, especially for an ankle sprain. So
yeah, that used to be it. They put you in that.
Yeah, so like immobilizing a joint, not the best unless there's like an actual fracture, which like if you twist your ankle, we can kind of tease out whether or not you
totally
have a
different
fracture.
situation. Yeah.
So like anytime anybody rolls their ankle, go to PT. Like sooner you get in the door, we'll get you moving a little bit better, slowly introduce movement.
So you don't advocate the ice?
No. So like a lot of the dry needling that I do would be like negated by icing and taking ibuprofen, because those are all anti-inflammatory based like interventions. So like dry needling stimulates a little bit of inflammation. Inflammation brings like oxygen, nutrients, tissue healing factors to the area. That's how you start to heal. So why would you want to stop the healing process? The theory behind it was that when you ice, you stop all of that excessive blood flow to the area, and that's going to reduce the swelling. And then but
you're not treating the injury.
Right. You're just making you feel better. So that's the biggest thing, is like the ice came from like a time of let's treat the symptoms, not let's treat what's going on with it.
That makes so much sense.
Now, if you had a surgery, so if you had a knee replacement or rotator cuff repair, hip replacement, something like that, that is a major trauma. There's a lot of like microvasculature that gets damaged during that. 100% go ahead and ice.
Right.
Like that's different.
Well, what always gets me is you see these professional baseball players who have the best doctor's money can buy, and the first thing they do is they go in the dugout after they pitched 6, 7, 8 innings, sling their arm up, ice pack, and they sit down, and I'm like,
yeah, I think some of that is like patient preferences come into treatment as well.
Mm-hmm.
Like if I told somebody like, hey, ice is probably not the best thing for you, but I'll leave that up to you. That's kind of like what I say. So if somebody is like, yeah, I'm going to ice and it feels better when I ice, that's up to you whether or not you want to do it. But me personally, like I'm not going to treat an injury with ice if somebody comes in the door with an ankle sprain or like a sore shoulder,
Easy for you to say.
I'm gonna have them doing like isometrics, just early on, doing dry needling, a lot of like myofascial cupping, other manual therapy techniques, and then some like specific exercises to get them moving again.
So you probably don't have a lot of chickens like me that come in there, middle-aged men that
I've
the needles.
There are people who don't like needling. They also, so like the clinic I was at, you had to pay $25 if you want to dry needling. With me, it's like it's included in the cost anyways, so I just do it.
Right.
But a lot of people, they'd be like, I don't want to spend $25 on that. And I'm just like, it would make you have to come to therapy less often, so you're going to spend less money in co-pays, right? So you're actually going to save yourself money if you spend that little bit up front. I don't do it every single time somebody comes in. I use it sparingly early on to like knock down pain so that now we can, load those tissues and start building some of that capacity in those muscles again and get you to where you don't need the needles. Like at most, I would say for tendinopathies, which is like tendonitis, or if you ever heard of bursitis, that's not a tendinopathy, but another common condition like that. It's usually a tendinopathy.
I'd tell you a big one around here is the carpal tunnel.
Oh, I have multiple women that I have treated with dry needling for mild to moderate carpal tunnel. So if you have had an EMG, or if you just have those symptoms, if you have an EMG and the EMG comes back and it says you have mild to moderate carpal tunnel, like let's do some dry needling on it. It works really well for that. If it's severe carpal tunnel and you don't want to have surgery, I say let's give it a try. Right. And within a couple visits, if you're not seeing any change in your symptoms, I'm not going to say, let's keep going with it and see what happens.
I want to answer this first, and then I want to come back to that. How much impact does it have if a patient only comes in and has a treatment and doesn't do any exercises when they go home? So, because we're lazy, you know that.
Yeah,
I mean, it is what it is.
So, like exercise compliance, like home exercise programs, like it's typically not great. There was a study; it was age 40 to 65, people with low back pain. They gave them one exercise, compliance rate was 73%. They gave them an additional exercise, so another group had 2 exercises to do, and it dropped to like 17%. So people were like, 1 exercise, I can do this. 2, absolutely not. Absolutely 60, not. So. It's like, but
good question.
I would say it depends on what's going on. So like for headaches and for neck pain, I don't typically give exercise because for most neck pain and headaches, exercise is not going to make it feel better, or like specific exercises. That's more of where like my hands-on interventions come into play. So I do like a lot of dry needling, a lot of like myofascial cupping, a lot of massage, a lot of manipulation, a lot of joint mobilizations. It's just a lot of like hands-on work to help reduce pain and get the neck moving again. So, but if you have like, let's say a rotator cuff tendinopathy, or you have like weak hips that are causing some knee pain, or you've got really tight ankles that are causing some knee pain, those are things where like you come in, get dry needling, knocks the pain out, you go home, you don't do anything for a week, you come back in, the pain's going to be there again. Right. You didn't actively participate in your rehab, so you're not going to get the outcomes that you want. So,
good question. So it runs hand in hand. Do the dry needling or whatever you do to alleviate the pain on the spot, and then you have to do the exercises.
Right. And that
makes sense.
That's one of the things. So like why I say like I'm more geared, or like I like working more with more active populations is because they're actively seeking me out.
Right.
Like they want to get better so that they can, get back to the activities they want to do. So if I tell them to do 100,000 jumping jacks, they're going to try to do 100,000 jumping jacks. I'm not doing 100,000. Not going to give them 100,000 jumping jacks. But like if I give them exercises to do, they're more than likely going to do those,
right,
and have a positive outcome with therapy. If you don't do your exercises, can't really expect to see a major change in your condition. I always tell my my patients like exercises are just like any pill that you take, right? If you don't take the pill, you don't get the effects of the drug.
Right.
So
do the work and you'll get the effect of it.
because a lot of tendinopathies and like joint pain are like tissue loading issues. So like muscles are either too weak or joints are too stiff. So, if you don't build strength in those muscles, or if you don't mobilize those joints, they're not going to just magically, become less stiff or become stronger. Like, you got to load those tissues appropriately.
Good question, all the way from New Zealand. I think that's awesome. And I said it earlier, winter, it's the time of the year for heart attacks and things like that, because a lot of us sit all winter. Then you have to go out and shovel the sidewalk once a week, and you're hurting your back and so
Yeah.
Get a hold of one of these gyms and get with this young man right here.
Yeah, I would say like kind of if you have social media, like pay attention to the gyms pages as well. You can add me on Facebook, my personal account, because I always post on performance, and then I will share my like performance page stuff. But just kind of keep a lookout for like the workshops that we do. So they're going to be full body workshops. Like, we'll do a little piece here and there. So
you have anything in November, December? Or are you going to wait until after the holidays?
We will do stuff in November and December. I haven't decided what they will be yet. November will probably be like a hip and knee related workshop. And December is probably going to be like something along the lines of low back strains, because that is the time when people are shoveling snow and
won't be long.
And
after today, it feels like it could snow out there tonight.
But... Oh yeah, it's crazy how like what was it? I saw this thing. It was like, you ever think about temperature? Like, your body's 98.6.
All right.
But 90 degrees outside is miserable.
Right.
And
then
95 degrees is like hypothermia. but then 60 degrees outside is like, what in the world?
Well, we have a cleaning tank that we use every now and then, a smaller one, and the temperature gauge broke on it. And I always joke with the younger guy that works there, and he goes, "You think it's hot enough yet?" And I'm always like, "Well, stick your finger in there." And he's like, "What do you mean by that?" And I go, "If it feels warmer in your finger, it's probably going to be hotter than 98.6. And he just kind of looks at me, and I'm like, "Don't do that. We'll get a gauge."
We have these. It's called a hydroculator. It's a big hot tank. It's got these heating pads in it, and like, my fingertips are immune to the heat now because I got tired of using the little claw. I just grab it out of there, throw it on the towel real quick.
Doc making bad decisions there. Now you can't be.
Yeah,
we got to believe in your word here.
Yep.
I know what's going to happen, and it happens every time we get off the air, and then he starts ripping into me about I need to come see him, get off my dead ass, and start exercising.
I don't think I use.
He doesn't
those
work
words.
it like that, but that's what I hear in my mind. So we're going to discuss this now, and that way when we get off here, I can shake his hand and say, "Hey, Doc, thanks for coming in. We'll see you in a month or so." You get your gym set up here, and maybe we can work something out where you can save my life, add time to the end of it, by helping. I have a lot of I have an element that I think I've discussed with you before that I was born with that not too many people know about.
Yep. One thing with like physical therapy, this is a quote one of my friends has said before, who's also a PT, but I like it a lot. It's physical therapy is not adding years to your life; it's adding life to your years.
Okay, that makes sense.
I think that's a good quote. That kind of represents like what PT is.
I got to get a shirt maker because we could make shirts like this all day.
Yeah,
and I'm almost ready to do that. That's next step here, by the way.
Yeah,
little hint to the fans out there. So,
but what I would like to do to get more people, motivated to get in touch with me, as long as you schedule a visit with me in the month of October, I will do like 50% off of their first visit. So
if they schedule an appointment with you in October, you're going 50% off.
50% off.
You can't beat that.
So that's just off of the first visit. So that includes like your free phone screen, and then that first visit is 50% off. So
it's a good deal. And he's moving back home, and he's going to have time to do this. And we're going
to as soon as we find a house,
Are you?
We're trying to move to like the maybe Greenwood or Franklin area, but I will be like working out of Martinsville, stuff like that. So
split the difference. You can live out there off 252.
Yeah,
there's some nice homes out that way.
Yeah,
Franklin, I got kids that live over that way now. So
yeah.
Anybody got anything else for the good doc? I always appreciate you coming in because you have so much knowledge and you have this demeanor about you that's just like, if you hurt, I can fix it. That's just your tone.
Like I'm just like where I'm at professionally. Like I think that I can, treat a majority of people's ailments, and if they're having pain, if it's been something that's been going on for years, chronic issues take time to get better, but I can at least get you to where you're doing things more comfortably. You might have some pain still, but if somebody is dealing with 9 out of 10 pain all the time and they've been dealing with that for, 5 years, and I say, hey, this might take some time, but I can knock that down.
Let's fix this.
Yeah. Let's get you moving a little bit better, so, because a lot of the times, like if I get you down to like now you have 4 out of 10 pain and you can tolerate doing, more movement based stuff, whether it just be like light exercise, anything like that, that's like the light exercise getting you moving again is going to be beneficial for knocking down your pain too.
Sure.
So
torn bicep, Jeremy says.
Like recently, or it's a long time ago and you're having shoulder problems or elbow problems?
The only real muscle that I've ever banged around quite a bit, but the only real muscle pull I ever had, because I did stretch a lot when I was younger, was a quad injury in football.
Yeah.
And that was basically like someone would stab a knife above my knee every step I took. Recent, he says. There you go.
I would say it kind of depends on like what he can and can't do. Like, do you have trouble picking up a coffee cup? Like, is it that torn? Have you noticed any like change in what your bicep looks like? Like, is there a divot there?
It's knotted up.
Is it?
I'm just saying, is it knotted up?
Yeah, is it knotted up?
Yeah.
Do you have a lot of bruising? Can you raise your arm up overhead? These are a lot of like the screening questions I would ask. If you feel like you've lost significant function in your, elbow, it might be something where, surgery is indicated depending on, what level of fitness you want to get back to. So,
Jeremy, form has changed.
Okay. So it really depends on like what you want to get back to. Sometimes they just do a what's called a tenodesis. So depending on whether the tear was up this way or if the tear was down lower, if it was down lower, surgery is probably going to be your best route just for that one. If it was up higher, we can do some, strengthening and see kind of what's going on, because you've got 2 like heads to your bicep.
He says lower. Yeah.
Lower. Okay. Yeah. So you might want to get like a consult with a surgeon at that point, because there's, depending on the degree of the tear, there's not much like therapy is gonna,
especially at that point, right?
Yeah. So like if there's significant bruising in the area and you see like a pretty big divot or a knot that's rolled up, therapy's not gonna fix that. So
no. Sounds painful.
Yeah,
seen it. I've seen they had a guy on I forget.
It's always the like world's strongest man competitions when they're doing the Atlas stones. And like I can't remember which powerlifter it was, but they were doing the Atlas stones. And it was like as he was holding it and like trying to get it up on the pedestal, you just see that go from like this big to
just flattened out on it.
Yeah, and it was just.
I saw a guy on I think it was basketball. His calf, like he did something to his calf, and it literally went into a ball.
Yeah,
and from stretched out muscle. And it just shrank down into a ball, and I was like,
"Yeah,
dude, that doesn't even look right." And I bet you that hurt.
Yeah, it's like a rubber band. Like you detach one end, and it just spirals up. We had in undergrad, like I was on the track team at ISU, and one of the cross country runners. He was also a mid distance runner, and I don't know if you've ever seen any of those indoor races, but they get like bunched up, especially at the collegiate level. And it just happened to be he was in the like right phase of his running cycle or gait cycle, and somebody with spikes hit like his backside of his calf, and his foot was in like a stretch, or his ankle was in like a stretch position. Yeah, sounded like a shotgun. It was just like a you know.
I've been next to a guy playing basketball when his Achilles blew.
Mm-hmm.
And you literally, it sounded like someone took a large mat and slapped it on the floor.
Yeah.
And I was like, what was that? And he just went down like a sack of potatoes and grabbed his foot.
Yeah.
And he's like, I think I just blew my Achilles.
Mm-hmm.
Couldn't walk, couldn't do nothing. We had to carry him out to his car and then took him to the hospital. But it sounded like a gun going off.
Yeah, one of the things that I'd like to do is get like associated with the sports teams in town. Like, if there are any athletes, like high school or middle school athletes that
I saw Chase Havlin was on there. He goes to ISU. He played for Martinsville.
Oh yeah,
yeah. He's a big dude.
Any athletes that have any type of like sports related injury, like I'm gonna be the best provider in town for that. Like that's
your thing.
That's my thing. So
I like it.
But
we do have connections with the football team again now. So I'm just with the high school again. So
yeah,
we might be able to help you some there.
Even if it's just like me getting in front of the coaches and saying like, hey, these are my services. This is what I have to offer. These are things that you need to have your players do before you even, get going with practice for the day or get going on the field.
Right.
I think that would go a long way too.
I think they hired a while back. They had
do they have an athletic trainer?
I think so.
Yeah.
I don't know if they're PT and all that.
Probably not.
No.
Probably not at the high school level.
No.
So.
But yeah, that would be interesting. Be a good deal for you.
Yeah.
Anything else? Jeremy, that's awesome. Appreciate the info there. And thank you for the great show comment. Anyone else have anything else to add or say?
All right.
I'm coming up on an hour anyway, so.
Yeah, pretty good time.
Doc, I appreciate you coming in as always.
No problem.
I'll get with you a little later on the, once you get to town. And maybe we can come over. There's Bob Denton. Bob's got pain you could deal with. I guarantee it. He's
probably from reffing all those Y basketball games back.
right. Well, let's just high school basketball, high school football, Michigan State football, and then briefly in the NFL on some things, and now refereeing YMCA basketball, coaches Mooresville football, and then comes in here and argues with me and Dean on sports nuts. So he's he might be able to have something you could help him out with pain wise.
Yeah, for sure.
But he's a big man.
Yeah.
Still big man.
I remember.
Yeah. We were gonna set something up to where me and him butt heads. I try to be the devil's advocate on everything. He said, it's a show. We gotta have
Gotta have.
So I fight back with him. And someone said we were gonna set it up for him to come over and just snap on me and toss me off camera and we kill the feed. But I was like, no, dude, he'll throw me through that wall.
He'll actually pick you up and throw you.
Yeah, right. He's a monster. Yeah. We love Bob, though. He's a good dude. Good for the show. Good for the community. Mike, thank you. Doc, thank you so much. Like I said, get a hold of me. We'll figure something out on once you get in town, and we'll have to come over and go live from your facility. And yes, I'll be the guinea pig. And
if you don't like needles, like I would say, don't do dry needling.
No, there's not an issue. I'm not going to do the dry needling, but I'm going to follow your advice on a lot of things.
Gotcha.
And especially movement and things like that. He knows the situation I have, and that area has needed dressed for about 54 years. So anyway, thank you all for tuning in. Doc will probably be back on within a month. That seems the way we do things around here. So what is today? Wednesday?
Yep.
I know we got no football this weekend. It's a road game, but we got some stuff coming up this weekend. So appreciate you guys tuning in. Take care. First night of fall. It feels like fall out there. Don't fall. If you do, come see Doc. So love you guys, and we will see you soon.